Just because a body part is hidden under the clothes does not undermine its importance or reduce our requirement for it to look or be shaped in a certain way, both for aesthetic appeal and for functional purposes. Yes, I'm talking about the female genitalia. Aging, childbirth, and hormonal changes can affect the female genital tract in a way that interferes with a woman's quality of life. Female genital rejuvenation procedures reduce, reshape, or tighten the female genital tissues to help restore a firmer appearance, a firmer tone, and a more youthful symmetrical appearance. It refers to a set of cosmetic surgery procedures which are performed on the vulva or labia, the outer and inner lips of the vagina, or the vagina itself. Now, who are the candidates for female genital rejuvenation? Childbirth, especially after vaginal delivery, the vaginal mucosa and the muscles, they stretch and the vagina loses its elasticity and its tightness. This often leads to decreased sexual gratification. Sometimes it can also lead to pain during exercise and sexual activity. It can also lead to urinary leakage or incontinence. All these changes may also be seen with aging. Some patients may have sagging, misshapen, overly large labia minora, which may be genetically present or a result of childbirth or aging. This is often accompanied and aggravated by the presence of hypoplastic labia majora. The hypertrophied labia is often a source of embarrassment and a woman hesitates in wearing tight-fitting clothes. It may also cause discomfort while exercising. Some patients also have overhanging clitoral hood, which leads to decreased sexual pleasure. Some patients may have excess fat on their mons, which projects out very prominent in tight clothes. Most importantly, women lose their confidence and self-image, and their sexual health is negatively affected because of these changes in their genitalia. So, genital rejuvenation is a daycare procedure often performed under local anesthesia. Depending upon the degree of laxity of vaginal tissues, a patient may be a candidate for surgical or non-surgical vaginoplasty. Non-surgical rejuvenation procedures, they use highly focused radiofrequency energy to cause the tissues to contract and promote collagen remodeling in the vaginal tissues, which leads to a renewed and toned vagina. We have FDA-approved devices like Arvati Tharviva and Inmode Votiva for these procedures. These are state-of-the-art equipments. With larger deformities, surgical procedures are a must to give the desired results. Vaginoplasty is done to tighten the vagina. Incision is given in the posterior mucosal wall. The mucosa is dissected, the muscles are dissected, and the muscle is tightened with sutures. And then the excess mucosa is excised and it is closed with absorbable sutures. For hypertrophied labia minora, labiaplasty is done, where the excess labia is excised in an elliptical fashion and the incision is closed with absorbable sutures. Along with this, some patients may also require fat grafting in the labia majora if it is hypoplastic. So for this, fat is harvested from the medial thigh, it is purified and treated and sedimented, and then some amount of fat, around 15 to 25 cc depending upon the requirement, it is injected into the labia majora. For overhanging clitoral hood, clitoral reduction is done where the excess clitoral tissue is removed. Liposuction over the mons takes care of the enlarged protruding mons. Coming to the recovery. Recovery after genital rejuvenation is very easy. Patient is discharged in few hours. Sanitary pads are to be worn for a few days because there can be some spotting. Genital hygiene maintenance is a must and they can use intimate wash, V-wash for this. Swelling increases in the first 48 hours. and so the patient is advised to use ice packs so that the swelling decreases and to sleep with a pelvis elevated position. She can use some pillows below the pelvis to keep the pelvis in an elevated position. This helps in decreasing the swelling. Most of the swelling subsides in 6 to 8 weeks and the patient can start seeing the results in that time. But the final results take about 6 to 8 months to be visible. Sexual activity is to be avoided for a period of 6 weeks. Genital rejuvenation is a very sensitive topic that many women face all over the world but are hesitant in discussing with their surgeons. When performed by a highly qualified provider, it can help a woman feel more comfortable, more confident in her body, enhancing her mental as well as sexual health.